We have about 2,000 active patients that we take care of here at the clinic. Most of those folks have a chronic disease such as diabetes and hypertension, although we are able to manage some acute care issues that come into our office.
My name's Cheryl Ingus. I called up here. In fact, Doug was the one that answered the phone, and I told him I didn't have no health insurance, and found out that they could help me. And with the clinic's help and everything, they got me on insurance. And after that, I saw the heart doctor, Dr. Nandra, and he examined me and everything and found out that I did have the blockage. And from there, it just cycled into different doctors. And a week and a ago, I had surgery.
Well, it's a very interesting case. She had coronary artery disease. She had moved here from Florida a while ago and was seen by the nurse practitioner in this clinic. And she was, of course, very smart and picked up the carotid bruit indicating that her coronary artery is tight, which led us to do further studies. And finally, we found out that her right coronary artery was totally blocked and the left one was 70 to 80%. Even though she had no health insurance, we were able to talk to the surgeon, the hospital, to make sure they could provide state-of-the-art care for her. If she had not come to our office and she received no further treatment, I think she probably would have had a massive stroke eventually and not survived. She's a lucky woman.
They called the different doctors to get me in to see them. And I mean, I'm just blessed. I'm very blessed.
I lived in Columbus, Ohio, and I was very sick. The doctor told me that I had been diabetic for years and I didn't know it. So when I became very ill, she told me that it was like past the point of no return. The doctor said that I only had 6 months to live. So I had told Miss Juliet, the medical assistant, that I was very sick with my diabetes. So she was very compassionate. And she told the nurse practitioners about my plight.
She didn't have a medical card. She had multiple medical problems, and we walked her through many of these steps, getting a medical card. Who does she want to be a healthcare provider? She chose us. She's very complicated. She's had many medical problems. We have help with very generous donations from a local physician who keeps our medication room stocked. Ian's been instrumental in getting a number of medicines through a company called AmeriCares, and we make the $4 medication list work to be our friend. And then we have Kathy in our pharmacy for patients who truly remain uninsured. We can get a lot of medications on the prescription drug program for patients who are uninsured.
I've been here a year. I'm so much better. I'm very happy here. And they gave me hope. I had given up, but they gave me hope. They made me strong. I've also been taught how to be compassionate to the people that come in, like the people were compassionate to me. I've been given love. I've been taught how to show how to love. So I treat the people like I want to be treated. I love them. God bless me to come to the Forestry Health Center.
When a patient comes to see a doctor or nurse practitioner, that's the key thing. You have to have a doctor or nurse practitioner. That's why it's so important for more folks to volunteer and come and be a part of our team here.
I know that even if I'm rather tired toward the evening when I'm done with my office, when I come to this facility, I certainly perk up. I think there's a purpose in coming to this facility, and I encourage other physicians to participate, and they would certainly find it gratifying as well.
But if you really want to spend even just a couple hours of a day in a month and come and feel like you can work at your own pace, you can make your decisions, and you can go home feeling like you really helped somebody, this is the place for you.
We had 14 doctors and nurse practitioners volunteer their time, and a multitude of other volunteers and students, providing over 3,800 hours of volunteer time. They are genuine and concerned and loving towards our patients. They are such fine examples of what doctors and nurse practitioners should be.
They all care about the patients. We have some very, very nice patients too, and they're very needy, and it makes you feel good to think that you're helping.
I see so much for the health center in the future. This is our time to grow. We need to be in our own building. We need to have our medical care and our dental care and the mental health care and our medication room all under one roof. And this is the time. This next year will bring big changes for us and will allow us to keep the care going for our patients and to expand those services, which means so much to so many people.
You go into the exam room and you can see the look of angst on their face, but when they leave, they just tell everybody, thank you for being so nice, thank you for trying to help me. That's what you hear the most, I think.
Despite the implementation of Affordable Care Act, expansion of Medicaid and Medicare, I think this clinic still needs to survive at its full capacity. I really want to thank the organizations and individuals who have made a tremendous contribution for this cause. And I hope you will still dig into your deep pockets and give us a little more.
We provide so much more than medical care and medication. We provide encouragement. We provide education on the chronic diseases. We connect people to other services. But I think the most important thing we provide is hope. We give people hope that they can have a happy and a healthy and productive life. And we're so proud that we can be a part of that.